and we're back to discussing mental health. I've just been going through a rabbit hole the past few days. I was doing a lot of research on, I don't remember how I bumped into it. I think it was from seeing a video by Dr. Ramani. I went down a whole parenting with mental illness type of thing. And yeah, there was stuff that I found about, I was trying to put the difference between a narcissistic parent and a parent with not emotional intelligence, but not emotionally ready, basically, right? And this was because I wanted to discuss forgiving our parents for not being exactly what we wish they would be. I'm currently at an age where I could be a parent, and a lot of my peers are parents already. So now it's time for us to really understand what our parents went through, forgive them, and figure out a way of how we can be better parents going forward. So that's what I was going down through. And then I ended up finding sociopathy and psychopathy and antisocial personality disorder, and what the differences are between those personality disorders and narcissism. Because those are also other words that I feel like we keep throwing around a lot. Somebody is horrible to you, they're a sociopath, they're a psychopath, they're a narcissist, without fully understanding that these are actually disorders. They don't necessarily mean that a person is a horrible person. They could really just be having an illness that is not managed. But anyway, I then decided that to start off this year, let's speak about the statistics that we might have going on in South Africa. Let's get right into that. I literally just Googled the latest news about mental health in South Africa, and I wanted anything that is going to bring me back to 2026. And you know, with Google now, you get the AI overview first. Now I wanted us to go through the AI overview. I will have the link to exactly this whole conversation in the description, so please do have a look at that. Alright, so the first thing that Google highlighted for me here, well, AI overview highlighted, is over 25% of the population reporting moderate to severe depression. 90% of these needing care go untreated. These are South Africans in mental health critical state. Yeah, in a mental health critical state, that is over 25% of the population, which is crazy. That's a problem if we don't know enough about mental health, mental illnesses, how to help others, how to manage our own. The next point that we're given is key mental health developments between 2025 and 2026. Great. The first one is teen suicide crisis, which I find to be an awesome thing for them to start with, because I think in Feb was Teen Suicide Week. And I'm going to look through that properly and actually put up where I got that information. But yeah. Teen suicide crisis. This is an alarming increase in teenage. There is an alarming increase in teenage suicide driven by untreated depression, anxiety, and substance abuse. I believe that is a problem because these mental illnesses do show up a lot in preteen and teenage years, and they can be there from a much younger age, but maybe not showing up. You know, during that time, parents are thinking something is not right, or the child is just being problematic or curious or whatever it is, only to find that actually there could be an untreated situation over there. And when they become teenagers, then it really shows up. And when teenagers don't know how to deal with it because they're not being guided on how to deal with it, then it can cross over into substance abuse, because they're going to be speaking to another teenager, and maybe another teenager will be like, I solved this thing by smoking weed. And then you just decide, might as well just go into that as well. There's a big chance of teenagers doing that when they don't have a proper support system. Besides the fact that the mind is just not fully developed, and obviously they're not going to make the best of decisions compared to an adult, but not having a community can also contribute to their bad decisions. We're on key mental health developments, right? So the next development for 2025 to 2026, substance abuse link. Substance abuse. A massive increase in synthetic drug use. Ooh, guys, have you heard about the concoction of what Nyope is? It's just like a whole lot of things. So, okay, synthetic drug use, particularly crystal meth. Oh, another big problem. Oh, I'm not too sure about here, but in Joburg, oh my goodness, there was a big crystal meth problem. It's exacerbating mental health conditions, often leading to acute psychotic episodes. And then when we see in the psychotic episodes, we're thinking it's the drug use that's the problem, without realizing there was something that was starting before the drug use became an option. Treatment gap. Only about 10% of people with mental illness have access to proper care, as 5% of the national budget is allocated to mental health. This is something we spoke about in a previous video. 5% of the national health budget, only 5% is allocated to mental health. That is very problematic. And how much of that allocated to mental health is invested in teaching health professionals about mental health and mental illnesses and how to manage people like that? Because if you're going to go to a government institution, they are already overwhelmed with a whole lot of people that can't afford to go to private places. And do they know how to manage people like that? How to treat people like that? And what triggers them usually? And how to actually get people to continue with their treatment? Because that's a big problem, that a lot of people that are struggling with mental illnesses don't really take their treatment seriously, either because of stigma or it's just such a hassle when you get to a public institution. But like, they only have 5% allocated to. Okay, system overload. Wow, we just touched on that. System overload. Mental health conditions have surpassed HIV as a leading cause of the disease burden in South Africa. That is crazy. I think it has gotten to that point. I would, in my opinion, it has gotten to that point because the stigma around HIV has decreased. A lot more people in urban and rural areas are so not open-minded, but generally have a much, much better understanding of HIV than they do of mental health, actually. And maybe going into putting as much energy as was put into educating people about HIV, if that energy was also directed now, because HIV, we've dealt with that, but now that we're dealing with mental health as a crisis, if that same energy was put into understanding mental health, I do think that would help a lot. Don't you think? I think so. Service challenges. There's a critical need for, yet a shortage of, community-based mental health services and personnel. Yes, there is a very big shortage of it. In my area alone, I don't know of community-based mental health services that are done by the community. The community is doing a lot of work with like GBV and HIV awareness and crime, all of those things. And they really do care about educating the youth as well. But to say community-based mental health services and personnel is something that's doing really good, I'm not too sure, because Special Wellness Initiative is currently the most active one. The others that are organizations that we look up to don't specifically deal with mental health awareness. They have divisions of mental health in their organizations, but it's not like 100%, focused on that the same way the South African Depression and Anxiety Group would be focused on it. So, yeah, there's work to be done, but amen. And then there's youth vaping and cannabis. We just touched on that part, on the substance abuse part and the teenage suicide crisis part. But okay, emerging research indicates a looming crisis driven by high rates of vaping and cannabis use among young South Africans. Well, yes, because they're also quite accessible. So I'm not too sure if that part needs regulating, but these are also results of the youth using that to substitute for not knowing where else to go. being told a lot about their behaviors, that there's something wrong with them, whereas they could just get medically treated. And then the stigma around being medically treated, which makes them not stick to their medical treatment. There could be other aspects around it, and I would really love to hear from you what else you think could be key mental health developments between 2025 and now 2026. Okay, so now we have regional and social impact. Regional, and there's 3 points on this, okay? So the first one is regional disparities. High rates of mental illness are particularly noted in the Northern Cape, Eastern Cape, Western Cape, Gauteng, Mpumalanga. That for me makes sense when they say Gauteng, because like everybody there. But also maybe because I've just been from there, but I did not know. Northern Cape, Eastern Cape, Western Cape, I would also believe that. But Northern, Eastern, and Mpumalanga. The Northern Cape, Eastern Cape, and Mpumalanga.
I think Northern Cape.
Oh, because it's okay. But isn't the rural area thing a difficult one, because those people are difficult in terms of being able to pinpoint to put them under statistic gating?
That's how they're even difficult to them.
It's not even a thing.
It's just easy. But again, we've seen statistics.
The link between poverty and mental illness. Oh, yeah. Kids are my here. How? The second one, pandemic aftermath. What a problem. Pandemic aftermath. Long-term effects of COVID-19, including job loss, food insecurity, and increased anxiety, continue to affect the population. I completely believe this, and I will always say that we are so far from recovering mental health-wise from whatever the pandemic just bombarded us with. Yeah. Third point, healthcare worker stress. Oh, yes. High levels of burnout among frontline workers have led to initiatives for improved, confidential, and accessible mental health support for professionals. And then they linked the National Institute of Health by the government. It's a government website, so I don't know if maybe the National Institute of Health has put together something for healthcare workers. But burnout is a very big problem, and a lot of people don't realize until they're in the depths of that. And also accessible mental health support that is confidential is also a difficult one, especially for professionals, because they wear a lot of a mask of what they need to do for when they're in their professional state, and knowing where to go to remove that mask and to be okay with not living under that mask or surviving under that mask, might be a difficult one. Okay, and lastly, we have Google has said for immediate free 24-hour support, the South African Depression and Anxiety Group mental health line can be reached at 0800 567 567. Yo, if my teenage sister hears that I just said 67, I won't hear the end of it. But okay, that was it for this one. Tell me what you are thinking about these points that Google AI has come up with, and if you think it makes sense collaborating that with the mental health state in South Africa. To me, it does make sense, and there's a lot of room for improvement. But yeah, tell me what you think, and I will hear from you, or I will get back to you in the next one.